Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Good morning, good afternoon, and good evening. The pandemic has reminded all of us of the heroic work that health workers do every single day. Health workers account for an estimated 3% of the world's population, but account for 14% of all infections with COVID-19. One of WHO's primary concerns has been to ensure health workers have access to personal protective equipment. We also advise that health workers should clean their hands regularly with an alcohol-based hand rub or wash with soap and water. And yet, new data from WHO and UNICEF show that 1 in 4 health facilities globally lack basic water services. In the world's 47 least developed countries, half of all health facilities have no clean water on site. This puts health workers and patients at risk from infections of all kinds, makes childbirth much less safe, and drives antimicrobial resistance. Addressing this gap is an urgent priority for WHO and UNICEF, and must be for the rest of the world. Preliminary estimates show that making sure all healthcare facilities in the 47 least developed countries have basic water, sanitation, hygiene, waste management, cleaning services will cost an additional $3.6 billion between 2021 and 2030. And we know that for every dollar invested in hand hygiene alone, there is a return of $15. In other words, investing in water, sanitation, and hygiene is not just the right thing to do, it's the smart thing to do. While the direct health impacts of the pandemic on young people have been generally less severe, youth are disproportionately affected by the long-lasting consequences of the pandemic. Disruptions to education, economic uncertainty, loss or lack of employment opportunities, impacts on physical and mental health, and trauma from domestic violence, to name a few. More than 1 billion students in almost every country have been impacted by school closures, and 1 in 6 young people worldwide have lost their jobs during the pandemic. Throughout the pandemic, WHO has been working with young people and many partners, including UNICEF and UNESCO, in several ways. We have supported and amplified youth-led initiatives on combating misinformation and mental health. We have engaged young people in co-creating communication materials for young people about reducing the risk of COVID-19 transmission. We supported the youth-led COVID-19 youth survey to assess attitudes and awareness of young people about COVID-19. And we will soon be publishing the results of a global survey about how young people look for and use COVID-19 information online. 2 weeks ago, we launched the WHO Youth Council to provide advice on key health and development issues affecting young people. Today, we're delighted to be taking part in the launch of the Global Youth Mobilization for Generation Disrupted, a new worldwide movement to support young people and involve them in the response to the COVID-19 pandemic. This new initiative is being led by what's known as the Big Six youth organizations: the World Organization of the Scout Movement, the World Association of Girl Guides and Girl Scouts, the Young Men's Christian Association, the World Young Women's Christian Association, the International Federation of Red Cross and Red Crescent Societies, and the Duke of Edinburgh International Award. Together, these organizations and networks actively involve more than 250 million young people. Through the new Global Youth Mobilization, The big six youth organizations, WHO and the UN Foundation, will engage young people around the world in the design of community initiatives to turn around the impact of the pandemic. And we hope that it will become a platform for supporting progress towards other health goals, including universal health coverage. The voice of the youth for Health for All is very crucial. In early 2021, the movement will issue a call for proposals inviting youth groups around the world to develop youth-led solutions to COVID-19 and an accelerator program to scale up existing response efforts. $5 million has been allocated to this initiative from the WHO COVID-19 Solidarity Response Fund, powered by the UN Foundation. The Global Youth Mobilization will also feature the convening of a Global Youth Summit in April 2021. Today, I'm delighted to be joined by 4 representatives from the movement's project board. Ahmed Al-Hendawi, Secretary General of the World Organization of the Scout Movement. Tarindra Aruma Peruma, an emerging leader and International Council member of the Duke of Edinburgh's International Award. Michelle Shiji Chiu, Youth Commission member of the International Federation of Red Cross and Red Crescent Societies. And Casey Harden, General Secretary of the World Young Women's Christian Association. Mr. Al-Hendawi, before I give you the floor, I understand that today marks the 100th anniversary of the World Scout Bureau. So I would like to wish you a very happy birthday and congratulate you for the huge impact you have had on young people over the past 100 years. Thank you, and you have the floor.
Thank you very much. Thank you, Director General, Dr. Tadros. Thank you for your leadership and for your very warm words and wishes to the Scout movement. And thank you very much for really the exemplary leadership you have extended in this response, and for the incredible team that we have seen at the World Health Organization as steering the response to COVID. Today, we are delighted to join forces with the World Health Organization. We're a group of some of the leading youth-serving and youth-led youth movements that are very concerned today about the societal and health impact of COVID-19. The COVID-19 challenge, as you rightly said, Director General, has paralyzed youth development and the ability of many young people to simply exercise their youth and to access opportunities to education or employment. And as you rightly said, we all know that the long-lasting impact of COVID-19 will be felt most by them. So these gaps need to be addressed. And we believe by joining forces and working together, we need to prioritize investments in young people. We believe that young people are opportunities in the response. They are not liabilities when we are combating COVID-19. And we need to engage with them, and we need to see the value of this engagement by recognizing the realities. Young people are calling for building back better, and they are calling for taking the lessons from all the things that went off a track before the pandemic. And I think it was a wake-up call for the world to think back of this youthful world that we have, with half of the world's population the age of 25. So today, this global mobilization is bringing together leading youth organizations from serving over 250 million young people around the world. But it's not only limited to the big 6 youth organizations, the IFRC, the Scout Movement, WAGS, and together with the Duke of Edinburgh Award and our colleagues on the YMCA and YWCA, we also would like to engage more youth organizations, the smaller youth organizations, the youth organizations and youth groups who otherwise would not be able to access these opportunities. That's why we would like to salute the World Health Organization and UN Foundation for reaching out to all of us, and for, in fact, for challenging us to come together and for coming up with solutions that would help in your response, not only to do and to deal with the health side of the pandemic, but also the societal impact of COVID-19. So this is an exciting moment indeed for us to join forces in investing and scaling up global youth-led response to the recovery efforts to COVID-19. Our mobilization is offering some unique solutions. As someone who has worked in youth development for years, we have been always calling for more funding and youth-friendly funding to support the local initiatives. So what concretely we will be doing, utilizing a fund of over $5 million and this global partnerships and community of supporters to the Global Solidarity Response Fund. What we will be doing is to accelerate some of these responses and solutions created by young people. We'll be investing, injecting more resources in youth-led organizations who, as I said, otherwise would not have access to these funding instruments. We will be scaling up existing response efforts. And as you rightly said, Dr. Tadros, we will be coming together to talk about how to build back better in a global youth summit in 2021 that brings young people and youth organizations across the world. So we're very excited about this mobilization. It's an exemplary leadership that you have shown, and not reaching out only for, say, organizations who have traditionally engaged with the World Health Organization, but also other organizations who can be instrumental in building back better. Thank you very much.
Thank you so much indeed. And I fully agree that this is not just about the big six, but involving all youth groups to lead the movement. So thank you so much for that, Mr. El-Hendawi. And now, Ms. Arumpa Peruma, and thank you for joining us today, and thank you for everything that the Duke of Edinburgh scheme does to engage and empower young people. You have the floor.
Thank you, Dr. Tejas. We all know that this year has been incredibly difficult for all generations. It doesn't necessarily have to be young people, but every generation is touched by this pandemic. And despite the fact that COVID-19 impacts older generations more directly, we believe that young people have the most to lose. And definitely they will be continuing to lose for years to come. And that will be as a consequence of the pandemic. The impacts of COVID-19 have led 1 in 6 young people worldwide losing their jobs, which is definitely a stepping stone for their career development, and resulted in lack of employment opportunities and lots of uncertainty during these challenging times, which is devastating as a young person for in all our communities. And of course, talking about my own country, Sri Lanka, the job losses and the lack of opportunities has led to increase in mental health issues amongst my peers. And also to talk about a bit of a positive approach on this, there was also significant growth in the innovative side of young people. And they were coming up with different innovations to respond to different aspects of the pandemic. So that was a beautiful thing to see as a young person. And despite all these scenarios, we all understand that there is a general sense of loss of direction and also a loss of hope for the future of young people and our future prospects as well. So also, I think this is a wonderful time where this mobilization programs come in, because it provides us with all the opportunity to realize our ideas and implement our own young people's solutions to health and societal challenges that our communities are facing, and which they are facing as a result of COVID-19. And definitely it is crucial to recognize and celebrate these actions which are being come up as a youth-led team. And also we aim to bring hope, and we can hope that we as a mobilization program and young people behind the force behind it will be a driving force for the change we want to see in all communities across the world, and to use all the diverse skill sets of young people to open up new avenues and opportunities. Also, we know that young people worldwide are already doing a lot of great work to alleviate negative impacts. And definitely this is an opportunity we can use to recognize, to celebrate, and to invest in all their wonderful further efforts. So thank you.
Thank you so much indeed, and my greetings to Sri Lanka. Ms. Chew, thank you for joining us today. And thank you all young people who work with the International Federation of the Red Cross all over the world. And you have the floor.
Thank you, Dr. Tedros. Honored to have the opportunity to speak here on behalf of young people today. Education has been particularly hard hit during the pandemic. As you have mentioned earlier as well, Dr. Tedros, worldwide, more than 1 billion students in nearly every country have experienced school closures, depriving them on critical education and learning opportunities. And young people are missing out on this, right? During the pandemic, young people are actually left stranded and lost without means to, obtain education. Antonio Guterres, Secretary General of the United Nations, has called this the largest disruption to education in history. While many young people are starting to get back to school, rolling lockdowns means that the COVID-19 risks to education are actually not over for us. The quality of or the access to education should not be compromised during a pandemic. Young people should not have to sacrifice educational opportunities in exchange for our livelihoods and health. Youth should still be able to learn and gain knowledge through various means, and this includes through informal and non-formal education. Therefore, this mobilization effort will actually help to provide young people with the resources for both personal and professional growth, while empowering us to take the initiative and propose our own solutions. Our generation is actually very aware of the social, economic, and environmental challenges facing us, our communities, and the planet. We are not silent, and we are not standing idly by. We want to help, and we are capable to help. We're really not super spreaders or troublemakers, but we are part of the solution in mobilizing and volunteering to see the change that we want in our communities. And this is why, as young people, we are really excited about this global youth mobilization, because it provides us with the platform to share our ideas, experiences, and solutions to build the post-pandemic future that we envision and want to live in. Young people want to build back better.
Thank you. Thank you so much, Michelle. I fully agree, and we hope the global youth mobilization will bring significant progress. And now, Ms. Harden, thank you to you and the more than 130,000 volunteers who work with the YWCA movement all over the world, and you have the floor.
Thank you very much. As the world's largest youth movements, the Big Six, we not only support youth, but we partner with young people. And we are so excited to champion this effort where we will have youth mobilized to lead the way so that we can all follow their excitement and their wisdom, like that which Michelle just shared. We will be supporting development of the solutions to help our world respond to COVID-19. And, this effort, this approach is really a bright spot in what has been an incredibly challenging year. We know, as the Big Six, that young people do amazing things for humanity, and this effort is really intended to further enable our young leaders and local and national youth organizations to take really good ideas, the wisdom that they have, to action and to innovate in support of their communities and our global community. And we also know that a useful, a successful, and effective pandemic response must involve young people, and it has to be relevant and it must respond to their realities, which is why we need to look to the youth leaders. We have a real chance here to do something quite remarkable, to come together, policymakers, governments, businesses, civil society leaders, youth organizations, for all of us to really come together and create a new deal for young people. We've already seen momentum around this really compelling initiative with ambassadors and influencers, as well as global brands like the NBA, Disney, and FIFA, taking interest in the plan and this collective vision. And as been stated, the doors are open for other partners. We know that that's really what's going to make this vision manifest. And that's partners from all sectors joining us, expanding the outreach and the impact of this global youth mobilization. working together is really the way that we'll reach the scale that's baked into the plan and into the vision. We're really grateful to the World Health Organization and the United Nations Foundation for the collaborative spirit, attitude, responsiveness with which you've approached this plan. It's that kind of new way of doing things that we can hold ourselves accountable to in order to, again, bring this to life and have the vision manifest. And also, of course, the generous funding is really how we're going to make this good idea happen. So with this initiative, we're going to follow the lead of young people to make sure not only that they're not left behind, but that we're really responsive and we're very responsive to the needs of youth and follow their lead because they know what's best. Thank you.
Viewing months to engage young people all over the world in the response to COVID-19 and to building a healthier, safer, and fairer world. Fadila, back to you.
Thank you, Dr. Tedros. And to our guests, I would like now to open the floor to questions from members of the media. I remind you that you will need to raise your hand, use the raise your hand icon in order to get in the queue to ask your question and please do not forget to unmute yourself. I would like also to inform journalists for their accurate reporting that Ahmed and Michelle connected from Malaysia, Tarindra from Sri Lanka, and Kasey from Switzerland. I know that this information is important for you. Now, coming back to our journalists, I would like to invite Gabriela Sotomayor from Proceso to ask the first question. Gabriela, are you online?
Yes. Thank you so much. Hola. Thank you for giving me the floor. In Mexico, millions of children have not returned to the school since the pandemic began. They have opened bars, shopping centers, but schools are still closed. The children have suffered a lot without seeing their friends. And, you know, this question, I honestly don't know whether I should ask this question, but I will anyways. One of the thing that most worries many of the children is if Santa Claus will be able to get home this Christmas, because he's very old, he's overweight. They are concerned about whether Santa Claus will be able to leave his house and whether he will be able to travel. So if you have any message to the children in Mexico and maybe children all over the world, thanks.
Thank you, Gabriela. Dr. Van Kerkhove will take this question.
Thank you very much for this really important question. I think you've highlighted a concern that many children have across the world. We can tell you that I understand the concern for Santa because he is of older age and he is of one of the older age groups. But I can tell you that Santa Claus is immune to this virus, and he is. We had a brief chat with him, and he is doing very well. Mrs. Claus is doing very well, and they're very busy right now. But he is immune, and we have heard from a number of leaders across the world who have told us that they have relaxed, the quarantine measures for Santa to enter the airspace. So he will be able to travel in and out of the airspace and be able to deliver presents to children. But I think it is very important that all children of the world understand that physical distancing by Santa Claus and also of the children themselves must be strictly enforced. So it is really important that the children of the world, still listen to their moms and dads and their guardians and make sure that they go to bed early on Christmas Eve. But Santa will be able to travel around the world to deliver presents. So thank you very much for that important question.
I'd like to thank Maria as well for that reassurance, but it's not just the kids of the world, Maria. We all believe in Santa, huh? That's something wrong with that.
It's working now, Dr. Ryan. Thank you.
No.
Yeah, thank you, Dr. Ryan. I would like now to invite Bianca Rothier from Globo to ask the next question. Bianca, are you with us? Bianca, are you online?
Yes, now I think I am.
Yeah, please go ahead.
Can you hear me?
Yes, very well. Go ahead, please.
Yeah, thanks, Gabriela, for this beautiful question, and Maria for asking. My question is on vaccines. And as the phase 3 studies have been showing, the new vaccines seem to have a very high efficacy to prevent people from getting sick. But how does WHO see the risk about vaccinated people spreading the virus to others? I mean, in this sense, should vaccinated people continue to use masks, not for themselves, but to protect the others?